Welcome to Consulting Chaik, and today we are going to talk about Operation Theatre. So this is under the department section. So before this, I would like to thank and give a shout out to the four people who voted for Operation Theatre in the last week. So the four people are Dipshika Roy, Jayanta Kalita, Anil Silwal, and Kukuvar Mefo. So thanks guys for helping me choose what topic to cover. So OT is basically related to IP, pharmacy stores, lab radiology, emergency ICU, and maintenance. Because we are talking about departments, this is the framework that we follow. So whenever we are talking about any department, right now we're talking about OT complex. So we'll be talking about the infrastructure first, then the manpower requirement, then equipment, then the supplies, consumables, then the process part, then the paperwork, that is the documentation, and then the training part. So let's start with the infrastructure. So for OT infrastructure, we follow the zoning principle. Zoning principle helps us segregate these four areas. So in order to see the whole layout, you have to watch the YouTube video, because on YouTube the whole frame of the screen will be available. So zoning principle, you have four zones: protective zone, clean zone, sterile zone, and then dirty zone. In protective zone, you can see in the sky blue highlighted rooms are there. So you have your counseling room, then you have your OT in charge room, then you have your change rooms, doctor change room separate, your staff change room is separate, male female all separated, and that leads to the and then you also have the trolley exchange way. Okay, so the trolley which is one trolley should be there for the OT, and the external trolley is not taken inside. So in the trolley exchange way area, this is where the patient is transferred to the OT trolley. Okay, and then these change rooms, it leads to the clean zone. So clean zone are like your doctor's lounge, your staff's lounge, pre and post-op room, and then your stores. Okay, then comes your sterile zone. Sterile zone is highlighted in green. So in sterile zone, you have your sterile store, you have your OT corridor, the substation, all that. Okay, so and then you have your dirty zone. Dirty zone, you have your dirty utility and dirty corridor. So in the layout, you can see I have used blue arrows to show the movement of staff. So the staff, they go from the change room to their lounge, and then from there they can have access to pre and post-op room, and then to the OT corridor, and then to their respective OTs. The important point here is the sterile, how the sterile instruments come to the OT. So here you can see right near the sterile store, there is one red box. So this is basically a hydraulic lift which goes up to the CSSD, and they send the packed sterile instruments to the sterile store. And when they have to take before they send the sterile this thing, they make sure that they disinfect the hydraulic lift properly, and they packed all the instruments. And from the other side, you can see after the procedure is done from all the OTs, the instruments goes through the pass box to the dirty corridor, and it all goes to the DU. And from DU, that is the dirty utility, all the biomedical, all these used instruments, it goes to the hydraulic lift and it goes to the CSSD. And another thing to notice here in this drawing is, you can see that from the protective zone there is a door which leads to the dirty corridor. This is the way where the housekeeping staff will go and collect all the instruments from each of the OT's pass box, and then he will put it in the DU, and then from the DU he will put it in the hydraulic lift to so that the used instruments will go to the CSSD. Okay. Now the manpower requirements. So of course in OT you need surgeons. So according to the the specialties available in the hospital, you'll have surgeons, and you have anesthetists who will be in charge of the whole OT complex. Then you'll of course have multiple anesthetists according to the caseload of your hospital, of your OT. Then you'll have nurses like your scrub nurse, circulating nurse, anesthetist nurse, and then your OT technicians as required, and of course the housekeeping staff. And these housekeeping staff, they are not supposed to go around. They are not supposed to work in other places. They are only dedicated for your OT. Then some other related staff, they are like ICN, biomedical engineer, and your maintenance team. So infection control nurse ensures that there is no the ICN basically takes care of the probable infection that may happen in the OT. So in the OT, the nurse goes and takes a swab from various places for each OT, pre and post, to understand what is the level of disinfection, how the disinfection has actually worked out. Okay. And then biomedical engineer, very important, because all the instrument, all these equipments which are there inside the OT, that should be running fine, and anything to do with their timely AMC calibration or maintenance, that should be taken care very diligently. And then comes your maintenance team. So they have to ensure the HVAC, lighting system, all these electrical, everything, all things are running fine. So the staff, the team of operation theatre, they don't have any difficulty in their operations. Then comes your equipments. So in equipment, the list of equipment that I am about to show is these are very basic ones, and as per different specialties, different surgeries that you are performing, you will have different equipments. So the basic equipments are like scrub stations, surgeon panel, your OT pendant. It's recommended that you have a double arm, so that it has more mobility, and you can place the pendants at your desired location. Then you have your storage racks. So storage racks for storing different instruments, medicines, everything. Then your pass box, of course, from the pass box from where you can pass the used instruments to the dirty corridor. HVAC. So yeah, of course, I've just added this because it is important. It's not actually a biomedical equipment, but it's a machine. That is why. And HVAC, the AC has a very important role in OT. So OT needs to maintain positive air pressure, and it also needs to have proper air circulation. It needs to have 20 air changes every hour, and out of those 20, 5 has to be fresh air changes. Then trolley for instruments, your defibrillator very important, X-ray view box, then patient stretcher, of course, OT lights, monitors, your anesthesia machine, C-arm, DVT pumps, your cautery machine, vessel sealer, harmonic sealer, bug hugger, your infusion pumps, PCA, fluid warmer, surgical equipment and instrument as per the need of the OT, of the hospital, of your whatever specialty you are following in your hospital. You have the supplies part. So in supplies, we can segregate it in different types. So protective apparel, your PPE, like your surgical gowns and all, gloves, face mask, shoe cover, all that. Then comes your instruments and accessories. So like surgical blades, needles, hemostatic clips, gauze. Then comes your fluid and injections, like IV cannula, infusion sets, syringes, drainage tubes, and your Foley's catheter. And then your for hemostasis enclosure, you have your bone wax, gelatin sponges, ties, all these things. For wound management, you have gauze, swabs, sponges, Vaseline gauze, surgical sutures, skin staples, all that. And drapes and field isolation, you have surgical drapes, sheets, towels, lap packs, all that. These are like very basic ones I have just covered. You can have more over this. Process in OT complex. So, doctor, the surgeons are doing the surgery. I'm not covering that. The main point here is the anesthetist. So the anesthetist takes PSC one day before, and in case of emergency, it is taken right before the OT procedure. Routine PSC, they'll cover everything, but in the emergency PSC, they'll cover only the vital points. When the patient arrives, the patient is taken to the pre-op. They again counsel the patients. They'll also take anesthesia surgery consent, and the patient is then taken to the OT for the procedure. And then after the procedure is done, the patient comes to the recovery area. From the recovery area, the anesthetist checks. Once the anesthetist confirms that okay, this patient is okay to be shifted to the ward, then the patient is shifted. So the recovery process happens there. Then the staff I'm not covering there. Staff, they are working with the doctor and the anesthetist. Patient PSC, pre-op, surgery, then recovery, and then it is the patient is shifted to the IP once the anesthetist confirms. Covered this. Then the material, sterile and other. So sterile instruments, it enters the store area, and then from the store area it is taken to the OT for surgery purpose. And once the instruments are used, everything is done, then these sets of instruments are packed, and then it is taken to the DU. From DU it is shifted to CSSD. Then the equipment engineering services. So there are basically two here. So maintenance, they do check the breakdown, they do the periodic checks and all, and TLD batch reports. So if you are using a CAM there, your TLD batch reports and lead apron scan reports are required, which has to be signed by a radiologist. And then last comes your infection control. So swab culture, the report, and if there are anything, then RCA kappa. Now the paperwork. Paperwork as in forms and format, register, and the documents. So you need OT register. Then you need OT environment control form, where you are writing all the temperature, the pressure difference, humidity inside the OT. Then your implant register. Then narcotic drugs stock register. So this stock register needs to be verified with the stock register in the pharmacy. When you start doing it, you should start tallying these two registers on a weekly basis. That is what I recommend. Then once you are used to the system, then you can do it monthly, once in a month. Patient receiving and transporting register. This is where you just maintain a record when the patient has come, when the patient has gone. Pre-anesthesia checkup form. Your OT reschedule register. So reschedule is like if an OT is rescheduled within 4 hours of time, you can leave that. Okay. So any reschedule or cancellation or postponement of more than 4 hours, that can be registered here. Prophylactic antibiotic register. You need to maintain that. You need to also write about the prophylactic antibiotic not given when there is a clean surgery. Surgical safety checklist. It is from WHO. You have to use this properly. This is to ensure that the safety is taken care during the surgery. Then consents, anesthesia, surgery, and for each surgery you need to use it. Very important thing about consent, you need to follow SNDT. You need to write the risk properly, and you need to take the sign of the patient or attendant. Biopsy, cytology register, then your OT SOPs and other policies which are related to OT. Then boards. One board you require in outside, right outside the OT or inside the OT, where everyone can see the OT schedule, and then the OT board. Now the training part. So training is very important. It is to ensure that everyone follows the process, the right process, the process laid down in the hospital. So training is very important. So mandatory annual training for everyone. Your infection control related things, hand hygiene, asepsis, and the other infection control practices. How do you segregate biomedical waste? How do you send it to the biomedical storage area, your fire safety and emergency codes. You need to understand what happens when there is an emergency, a fire emergency or whatever. And then your BLS for code blue. Certain mock drills needs to be done. Okay, so OT staff, they have to undergo BLS training as well as ACLS training. Then surgical safety checklist training, how it is filled, how it should be filled, who fills it, who signs it. Then OT specific training, sterile techniques, universal precautions, OT zoning and traffic control, equipment handling, your safe patient transfer, positioning, how you do surgical site, not surgical site infection. It is to be done by the ICN. High risk meds and safe injection practices. And role based, your surgeon anesthetist, their consents and antibiotic prophylaxis, timeouts. OT nurses, technician, instrument sterilization, linen management, PPE use. For support staff, cleaning protocols, waste handling, and all induction, like your what is the vision values, disaster, mass casualty drills, patient rights. These are basic requirements of training for OT staff. So thank you for watching this video till the end, and please like, comment, subscribe, hit the bell icon, and please share this video to anyone who you think should be watching this video. Thank you.